My name is Andrei Turtoi and I'm a scientist at the INSERM Cancer Research Institute in Montpellier.
Hello, I am Régis Souche. I am a digestive surgeon at the University Hospital of Montpellier.
Today we would like to talk about our pancreatic cancer biomarker discovery study starting from endoscopic ultrasound-guided fine needle aspiration samples with the support of our bioinformatics expert Jacques Collange and Guillaume Tosato.
Pancreatic ductal adenocarcinoma is a deadly malignancy. You know that we can operate only 20% of patients who are a very small subgroup of patients. This poor prognosis of pancreatic cancer is due to the lack of specific symptoms and the absence of validated, reliable and sensitive biomarkers.
The discovery of new biomarkers is ideally conducted in the malignant tissues themselves. However, especially the pre-malignant lesions are not available for research because they are required for the pathologist to make the diagnosis. So this is why many studies have attempted the discovery of biomarkers from body fluids, such as, for instance, blood. However, the biomarkers are very diluted in the blood, for instance, and they are covered with other species that are highly abundant and not of interest. So in this blanket of noise, it's virtually impossible to perform a very good biomarker discovery and find these new biomarkers that could in fact bring us to a more earlier diagnosis of cancer. Now, an interesting approach is to go and mine the interstitial fluid, which is found in the close proximity of the tumor. And there were some studies that have attempted this. However, none of them was really made in a clinical setting to render it compatible with the clinical practice. Because after the mining of the interstitial fluid, the biopsy still has to be usable for the diagnostic procedure.
Endoscopic ultrasound with fine needle aspiration is the connecting point between all stages of pancreatic cancer and its differential diagnosis. In the present study, we collected 58 conservation fluid resulting from cytofiltration by pathologists. Then the samples were processed for protein extraction. We demonstrated that these fluids contain a large number of protein, allowing a proteomic analysis. A huge bioinformatic analysis isolated a 19 protein signature. You can see on this map, according to this signature of 19 proteins, two clusters predicting the final diagnosis, PDAC or no PDAC. We constructed a protein signature score, that is a quantitative variable that corresponds to the sum of the signal of the 19th protein contained in each sample. We show that protein signature score was performant on specificity and sensibility. Its performance was improved by adding to our test the variable age over 54 years old, giving to our test a predictive positive value of 100%.
The PanExpel-2 prospective study is enrolling patients who require an endoscopic ultrasound and fine needle aspiration for suspicious pancreatic lesion. And the aim of this prospective study is to collect clinical data, the conservation fluid data, as in PanExpel pilot study, and finally construct a blood collection with more than 200 patients in order to try to validate the present results.
Given the fact that this discovery method is simple, doesn't involve any kind of interference to the clinical procedure and the material is readily available, we hope that based on our results, clinicians worldwide will be in fact motivated to collaborate together and exchange this type of sample in order to achieve even greater collection of this material and analysis and discovery of potential biomarkers, which we know that can be different between different ethnicities, countries and backgrounds. So we really hope that this is going to offer new pathways in the discovery of clinically measurable serological biomarkers. Thank you for your attention.